Hello, hi everybody. This is Chandru. I'm from Ireland, working in a mental health setting and services past 1 decade. I would like to share today regarding World Mental Health Day 2020 and the theme and the mental health. What is mental health? What is mental illness? How people are aware? What's the economy is contributions towards mental health services in 2020 and then the future. So, what is theme of World Mental Health Day? The theme is mental health for all, greater investment, greater access for everyone and everywhere. What is great investment? The greater investment. So, the mental health organizations needs to provide a service. They need to establish their investment to reach the community who really need it, and where there's a lack of support and access in all over the world, especially in low economic countries and middle economic countries. 70%, 74% of population have no access for mental health services. So, what is mental health? According to WHO, mental health is a state of well being in which an individual realizes his or her own ability to cope with the normal stress of life, can work productively, and to able to make a contribution to his or her community. That's called mental health. So, what is mental illness? Mental illness is a physical illness of the brain that causes disturbance in thinking, behavior, and emotions. So, why it's happening? What could be the cause? The cause could be the genetics, could be brain chemistry with serotonin or dopamine level in balance in the brain and the structure of the brain. And it also, there's so many research going on what's happening, what's the causes of mental illness. And the main common mental conditions are divided into two. One is anxiety disorder, another one is mood disorder. Under anxiety disorder, 18% of adults is suffering with anxiety disorders, which they have PTSD, it's post-traumatic stress disorder, and OCD, obsessive compulsive disorder, and then they have generalized anxiety disorder and phobic disorder. All comes under anxiety disorders. Mood disorders is another huge problem in the mental health services. 10% of adult population is suffering from mood disorders such as depression and bipolar affective disorders. So how they're going to do it? We need an economic forum. In economic forum, their expectation is $16 trillion dollars need to be invested in between 2010 and 2030 to respond emergency services and health services in the community, to restore mental health in the community. How we are going to do it? Together we are stronger, and together we can make a big difference all over the world. And when you talk about the service, there is a circle of care. It includes healthcare, community, family. So there is a 4 part in the circle. You have to understand the fact, and then healthcare access, and the community-based support and awareness, and the family support. It could be a 4-way of circle in order to provide a very good services. And then, when think about the theme, the last year in WHO 2019, the theme was promotive and suicidality to control. By WHO, they put a theme because of the prevalence of suicidal was too high in the adolescent population aged between 15 to 21. In that case, say every 40 seconds somebody is dying with mental disorder. 1 billion people lives with mental disorder as of 2020. 3 million people dying due to alcoholism. And then there are many countries has a discrimination, and they have legal implications, all affect mental health services. So How you're going to rectify showing individual respect and acceptance, advocating within our circle of influence, help ensure these individuals have the same rights and the human rights are protected. Learning more about mental health and mental disorder and the services which will help us, mental health is a human right. It's a time that mental health is available for all. The quality of access should be given universal. It should be accessed by every citizen of the world. It's urgent required as a world crippling with the current health emergencies. That's all today. Thank you so much.